Hello and welcome to Everyday Creation, a show about living our purpose, lifting our vibes, and expressing our creativity for the highest good. I'm Kate Jones here with Dr. Adeola Fakolade, a family medicine and public health and general preventive medicine physician working in Ashtabula, Ohio. Welcome to the show, Adeola.
Thank you. I'm so happy to be here. Thanks for having me.
Pleasure to have you. Ashtabula is kind of a long way from Nigeria, where you're from. Why did you come to the US?
So yes, you're right. I'm a bit of a long ways from home.
Just a bit.
Yes, yes, yes. Uh, and my journey to Ashtabula has been Nigeria through Pittsburgh, Cleveland, and then Ashtabula. So it wasn't straight to Ashtabula. But while I was in medical school in Nigeria, I knew that I wanted to come to the US for training because the United States healthcare system is one of the more advanced like healthcare systems in the world. Now, granted, it's not perfect, but it's pretty good. And the training opportunities here are probably one of the best, if not the best in the world. There's a lot of research going on, et cetera, and all of that. So when I was going through medical school and graduating, I already knew that I wanted to do that because I wanted to just to be able to be the best doctor that I could be. So I knew that I wanted to come for my specialty training in the United States. And so I graduated from medical school in 2011. And so in Nigeria, when you graduate, you have to go through like a 1 year mandatory service to the government. So it was during that time that I decided to sort of start taking the steps to move from Nigeria to here. And those steps entailed taking the board exam. So the same board exams that medical students would take here in the United States, I had to take them. And so it was like United States medical licensing examinations. There's a total of three exams. There's a step one, there's step two clinical knowledge, and there's step two clinical skills. And then there's a third step, step three, but you don't really need that to get into residency here. So during that year, I just kind of sat and studied and took basically all the three exams that I needed to come here. It took me about like a year and a half of studying. Especially my life then was go to work, come home, study, bed, wake up, go to work, and just rinse and repeat all over and over again. But it paid off, thankfully, because I'm here now. And so I did that. And then eventually I had to come here to do like a clinical rotation. I had to come for interviews. And thankfully I matched. So I matched into a family medicine residency program in Pittsburgh. It was the University of Pittsburgh Medical Center in McKeesport. It's an absolutely, absolutely wonderful program. It is very international medical graduate friendly, number one, but it is also it serves like an urban underserved population in the US. There's a lot of need where the clinic is and a hospital where the residency is based. And so you get to serve a population that really needs that help. And in my program as well, there were different tracks. So if you wanted to get more training in like a specific track, we have like the HIV track, we had the global health track, we had obesity. I think now we have obesity medicine after I graduated. And then there was also a wound care track. So I also got into the global health track. And so part of that was also kind of traveling abroad to go do some medical rotations abroad. So I went to Ghana, I went to Honduras. I was able to start like a project as well in Ghana that I kept going for about 2 years. So I had a lot of wonderful, wonderful experiences in residency. And so I think it was towards the end of my second year. So the family medicine residency training in the United States is 3 years. And so it was towards the end of my second year that I started sort of getting a little dissatisfied, if you would, with just the status quo. It almost felt like I was seeing the patients over and over again for like the same things. Like, okay, you're here, your blood pressure is is high, but just your medications, etc. And it just felt like I could be doing more to maybe potentially even prevent the patient from showing up in my office in the first place, or at least showing up in my office with a problem. You know, maybe just helping them like leave better or leave healthier, so to speak, and take more of like a preventive focus than more like treatment based. And so I decided I did some research and then I found like preventive medicine, like general preventive medicine and public health. And so I started applying for fellowships in that and I did match. And so I matched that Case Western Reserve here in Cleveland. And so that's the Cleveland part of my journey. And so I did my fellowship for 2 years. Part of that, you have to get like a master's in public health. And then we do different rotations in public health, essentially. So we do healthcare management, we do healthcare policy, we do core public health, like with the Board of Health. There are also multiple like elective rotations that you can do. I did a rotation actually in DC with the United States Preventive Medicine Task Force. So that's the body that kind of makes screening recommendations for the United States population, saying like, maybe your doctor has told you you need a colonoscopy. They are the ones that sort of set those guidelines, so to speak. And they do that. It's very research based, very evidence based from data from the US, data from Europe, all over the place. So I did that as well. And then in my last year of the fellowship, which was 2019 to 2020, we had this thing that happened to the world, the pandemic. So if there ever was a time to be doing a public health fellowship, that was the time to be doing it. It was very busy. It was a lot of hard work, but I am so grateful that I got the opportunity to train during that time. And I got a lot of on the job training, like just bread and butter public health. And it was really, really fulfilling work. It was really, really rewarding work just for me personally. I did a lot of work with the nursing homes because the nursing homes were hit pretty hard. During the pandemic. And that's also a vulnerable population, people that are in nursing homes. They're at higher risk where there's a pandemic or there's an outbreak, etc., and all of that. So once I graduated from my fellowship, then I completed like my waiver at Ashtabula. It's just an hour, if that, from Cleveland, but it's also pretty underserved as well. It's considered rural, and there is a big need out there, especially for primary care. So I had to do that for 3 years, and then I just kind of stayed on because again, I enjoy that work. I want to be working with like an underserved population, and so I stayed on there, and I don't know. So far, so good. I'm there. I do commute. I do have a little bit of a commute. It's like between 40 to 45 minutes in the morning or 42 minutes, kind of depending on how fast I'm driving that morning. Always very carefully, always very carefully.
Of course.
But that's the time that I used to kind of catch up with my family. My family is sort of spread everywhere. My mom is in Nigeria, so she's 5 hours ahead of me now. That's going to change with the time change. And then my sisters, they're in Canada, different parts of Canada. I'm in the same time zone with one of them, different time zone with the other one. But usually on my commute to work, I sometimes catch up like with my sisters. I call my mom. I listen to NPR. I love NPR. I listen to podcasts. Lately I've been listening to your podcast. There's always something to do. I listen to audiobooks, so it's not bad. It is not bad at all. It's over before you know it. So
And some articles that I've glanced at, I haven't actually read the whole articles, but they say that actually commute is good. So you have a little time to lead up to work and also to kind of come down from work.
yeah, yeah. I do enjoy. I'm kind of lucky in that I have like the perfect amount of time. 40 minutes is not too short, but it's not like an hour where you're just like, oh my gosh, I just want to be home. So I think it's a good amount of time to get some things done, catch up with family, catch up with friends, and then just decompress before you get to work or before you get home. So yeah.
You seem to have a very positive attitude about everything, including, including helping people who generally don't get health care. And I think that is such an important thing to do because of the whole prevention part of it. So I really like how you've turned it into this, well, certainly a passionate thing for your work, but also to be a positive thing. Okay, here is what can be done rather than bemoaning the
Yeah.
situation that exists.
Yeah. I always say this thing like time is going to pass, right? We're all here. You're going to wake up in the morning, the sun is going to rise, and the sun is going to set. Time is going to pass. Time is passing for everybody, no matter what. You can let that time pass angry and upset, Or you can let that time pass with you being happy and just, being optimistic and positive and sharing some good in the world. And I choose to do that because, time is going to pass anyway. You can choose how you want to spend your time, but it's going to pass. My general.
Absolutely. That's a wonderful way to look at it. So that's all part of prevention too. It's,
Yes. Yeah.
I mean, a good attitude, positive attitude, working toward goals, having good relationships, just all that stuff. And the good relationships are also with yourself. You have a good relationship with yourself, and then you tend to be happier.
Yes, yes. And honestly, I would say that the relationship that you have with yourself is probably the foundation for the relationship in how you show up in the world and how you relate to other people as well. So your relationship that you have with yourself it's probably the most important relationship you're gonna have in your entire life. And actually when you were talking there, it just took me back to medical school. So one of the first things we learned in medical school was the definition of health. So the WHO definition of health, and I would never forget this because I don't know, it's just one of the first things that you learn, right? They define health as a state of complete physical, mental, and social well-being, and not just the absence of disease. So underline that, and I think it's a really profound statement because I think a lot of times some people can look at health and look at it as like, well, you know what? I'm not in the hospital. I'm not sick, etc. I'm home. I can be with my family and then that's it. But I think that definition speaks really to thriving and just doing well. And so I really, really, really like that definition of health because you can be okay physically, but mentally not feeling well, not feeling great. You might not have great like social relationships and connections, which is also a big issue in the United States. So you might be abusing substances, etc., and all of that. So I really like the definition of health. So
It's terrific.
yeah.
So, one of the things when we had our previous conversation, you mentioned something about a shift in US healthcare that's coming. Would you talk about that?
Yeah, so right now, the US is in a little bit of what I consider a transition period. Traditionally, care of patients has been sort of reimbursed on a fee-for-service basis. So you get paid on the number of patients you see. It doesn't really matter how well they're doing or how well they're not doing. You just get paid. You see one patient, you get X dollars. You see two patients, you get X times $2. You see, et cetera, and all of that. But right now, the United States is sort of switching towards more like a pay for performance model where you get paid based on outcomes, especially in primary care. It's just like your patients that have diabetes. How's their diabetes doing? Is it well controlled? Patients that have high blood pressure, how are they doing? So it's shifting more from a quantity to more like a quality payer perspective. Because again, we're in that transition period, we are we still have there's still a lot of vestiges of the fee for service model, and then we're trying to fit like the quality model into it. So there are some growing pains, as with anything that is new, but I think that is going to work itself out over the next decade or so. I'm also board certified in lifestyle medicine, and lifestyle medicine sort of focuses on prevention essentially, and it focuses on like lifestyle choices as sort of medicine. There's like six core pillars. There's nutrition, there's exercise, there's stress management, there's social connections, and then making sure you're getting enough sleep, and then substances as well. So just in general, seeing that shift in the US to more prevention focused, more outcome based than just fee for service, which I think is good for everybody. It's a bit of an adjustment. I think for the patients, really for all the players in the healthcare system, talk about insurance companies, the physicians, everybody. But eventually, I think it's all going to be fine. It'll settle in. We'll settle into it eventually.
I'm so happy to hear that it's going that way. That is terribly important and not have, just managing with medicines all the time and everything, because by the time you get to that point of needing medicine, there could have been so many other things to do before that time.
Yes, I agreed. I agreed. The average person, and this is just, like my personal opinion, obviously, yes, there are people who are born with certain conditions, congenital conditions, but the average person, I think, if we kind of focus on lifestyle medicine and prevention, If we do it right, that person hopefully is not going to need a lot of specialists. That person hopefully just needs like a primary care physician. That's it, who is like keeping an eye on their health and kind of helping them stay healthy throughout their lifestyle, if it's done right. So,
Great. Well, please talk about the importance of helping patients have access to primary care. I know you're really passionate about this.
yeah, yes. I believe that primary care is the bedrock of any like high functioning healthcare system. If you want better health outcomes for your population, then you should be investing in high quality primary care. For some of the reasons I've already mentioned, a primary care physician or a primary care provider, because it's not just physicians that provide primary care in the United States, it's different players. But a primary care provider really should be, from a patient perspective, really should be like your quote unquote partner, quote unquote guardian to help you kind of navigate the healthcare system. Your primary care provider is like your partner in your health. Your primary care provider should be your champion for you just staying healthy. I cannot overemphasize the importance of primary care. And obviously, I'm a primary care physician, so I might be a little biased, but I think it's also true.
That's why you went into it.
But
You went into that part of medicine because you saw the importance of it.
right, right. And for a while there, actually, when I was in medical school, I thought I was going to go into oncology. Because I think I told you from my last conversation, my dad passed away from cancer, stomach cancer. And one of the contributing factors, I think, because again, we cannot go back and undo things and get like the exact causes as to what happened or what didn't happen. But I think one of the things that certainly didn't make anything better was the fact that he had like a misdiagnosis. Like he kept going to different, doctors, going to the hospital, and he just couldn't catch it on time. And by the time they found out, like it was too late. And so for the longest time, I thought, yeah, oncology, oncology, oncology. That's what I was going to do. But it didn't really sit right with me. It just felt like that sort of like medicine after death, so to speak. And so in a roundabout way, I ended up in primary care, which is on the prevention side. So I'm really passionate about cancer prevention as well. So, like, I will talk to my patients until I'm blue in the face about getting the vaccines that can prevent cancer, about getting, like smoking, like quit smoking, etc. If they're using, like, they're drinking a lot of alcohol, like, I talk and talk and talk until I'm blue in the face. So, yes, so that's sort of a roundabout way as to how I ended up in primary care. So,
You said something to me when we spoke last time that even when patients have access to primary care, they don't really maximize their time with their physician. So please talk about that. What advice do you give them?
oh boy. I think we may have unleashed the floodgates here, but I'm trying to keep it concise. And part of this, the way the healthcare system is set up in the US, most primary care offices, they have what, 15 minutes, if you're lucky, 20 minutes. That's the appointment slots they have for each patient. And that is just built on the fee for service model as opposed to, like the outcomes model. So, because it's like, okay, just get the patient in, you need to fulfill their prescriptions, done. Next patient, et cetera, and all of that. And so I think it's important for patients to understand that because I think it can help them sort of maximize their primary care visits. The first thing I'd say is show up on time for your appointments. Don't be late. Because again, out of that 15 or 20 minutes, the medical assistant is going to room you, going to take your blood pressure, going to find out like why are you here today, etc., and all of that. So if you show up late, you're already kind of cutting into your time. And if your doctor is already running behind, you just don't have as much time to talk about your concerns, and your doctor is sort of worried about running behind as well, and trying to get to the next patient, etc. So in a way your visit can be a little rushed, and you don't want that. You might be waiting like 2 months for this appointment, and then to get there, and then it's like, well, that was kind of a waste of my time, or you leave your appointment feeling dissatisfied with the outcome. Nobody wants that. So show up on time, show up before your appointment time if you can, show up on time for your visits. And then the other thing I'd say is be very organized. Okay. Know what you want. What are your goals for this visit? What is important to you? You're going to see your doctor today. What is it that you just absolutely have to get addressed at this visit? And lay that out right from the beginning. Okay. tell your doctor, hey, this and this and this and this is what I want to discuss today. And bear in mind that your doctor probably has some things that they want to talk about with you as well. Depending on, if you had labs completed, something is going wrong, or, we got to talk about diabetes, etc., and all of that. But just lay it all out up front so that you and your doctor can come up with a plan like, okay, if we can't address it all today, maybe we can pick the top three things. Like this has to be done today. So just be upfront. Don't spend your time talking about something that is not as relevant and then 20 minutes into the visit, you're like, oh, by the way, this is something else that I want to talk about. I think it leaves everybody kind of feeling a little dissatisfied. So be very, very organized. And one thing that I've noticed too, I think a lot of patients often don't understand the different types of visits. As a general rule, I'd say there's three kinds of visits in primary care. There's your annual wellness exam or physical. That's where you go in, you talk to your doctor, they're talking to you about, like diet, exercise, colonoscopies, smoking, immunization, etc., just like a wellness check. And then just making sure that your chronic conditions are stable and they're well controlled. That kind of visit doesn't really include bringing up new problems. Okay, this is just for the physical. They're going over your medical history, your family history, going over your health behaviors, etc., and all of that. And then there is just like a follow-up appointment, which is just, oh, I'm just coming in to follow up on my blood pressure or diabetes or depression, just to kind of make sure everything is okay. We can adjust medications if we need to, etc. And then the third type would be like an acute visit where if you woke up in the morning and you're like, oh, I don't feel good today. Or, I sprained my ankle yesterday. You call like your doctor's office and they're like, oh yeah, sure, we can fit you in. And then we're just addressing that specific thing. So in my experience, I found that a lot of patients don't even understand that difference, essentially. I was going to say dichotomy, but there's three different types of visits. They don't understand that difference between the types of visits. And so I think understanding those kind of visits can help you as a patient also show up prepared for your appointment. Now, that being said, oftentimes, because again, there's just not enough primary care doctors, many doctors may offer to maybe combine, like your physical exam with something else. So during that visit, even though they're technically not supposed to, be addressing any new problems, but you're there in front of them. Okay, let's talk about it. Let's figure it out. Let's get you taken care of. So oftentimes these visits are combined. Just something for you to kind of keep in mind as patients. The other thing I would say, and these are just general things, is find a primary care provider that respects you. Because I think that a primary care provider that respects you will listen to you. A primary care provider that listens to you can actually help you. So if you get connected with a primary care provider and it just feels like things are not working out, like it's okay. It's okay. Sometimes some things just don't work out, sometimes personalities, etc. It's okay. But because of how important primary care it is very important to find a primary care provider that you connect with, somebody that listens to you, somebody that respects you. Okay. So keep that in mind. It might take a few tries to find somebody that, is a good fit, but keep going because I think it's worth it to find like a primary care doctor or provider that you just absolutely love. I think it's very important just because of the importance of primary care. Other tips that I would say is be kind, be human. Okay. Don't show up to your appointment and then be rude to the front desk staff or be rude to, the nurse or be rude to the janitors. Just don't be that person. Nobody likes that person. Just don't be.
I think that's good general advice
Yeah.
wherever you go.
Yeah. Yeah. Just don't be that person. And in general too, I would say as well, if your PCP wants you to do a test or says, make this change, like do what your PCP asks you to do. If your PCP says, oh, we're going to make that change or, use this medication, etc., use it. And or if you don't want to use it, have an honest conversation with your PCP about like this is why like you'd rather not use it so that they can come up with an alternative for you. And again, I think that goes back to finding like a PCP that you're compatible with or is compatible with you and someone that will listen to you. Because I think it's sort of pointless if you have a PCP that you don't respect. That's the other part of it. Find a PCP that you respect as well. When you're not doing what you're supposed to do, we're chasing our tail. Like we're use this medication, you're not using the medication, and then you come back and, well, you're not better. Well, yeah, there's a reason why you're not better because you haven't been using the medication. So it can be very, very frustrating and counterproductive. So find a PCP you respect and do what your PCP tells you to do. Find a PCP that you trust as well. I guess that's also the key element. You got to trust your PCP. So, so I think I'll stop there for now because if you let me go, I will keep going. So, yeah.
Well, it sounds like you're speaking from experience. I know you have confidentiality that you have to really abide by, but in general terms, have you felt that frustration sometimes?
Yes, I have. It's just sometimes it's not that bad. I think maybe the reason that I'm talking about is like today I had kind of a situation like that. I'd prescribed the medication, I'd ordered some blood work, and I saw the results of it. I was like, something is not right here. So I asked my staff to reach out to the patient, like, hey, what's going on? Are you using this medication? And then the message came back, oh, the patient is using the medication minimally. I'm like, okay, what does that mean? Why? So that's a conversation I'm gonna have at the next appointment.
Creative, don't you think, Emily? The patient is a minimalist.
Yeah. Yeah. Well, I understand that, but then the problem is not really going away. So we have to find a solution. So that's a conversation that I'm gonna be having soon.
That's great. Well, is there anything else about primary care that you'd like to talk about?
What I'd say too is, again, because of the shortage of primary care in general, oftentimes, and especially if your primary care provider is not in private practice, oftentimes your provider is going to work with other providers. So they work in a group. And so if you call your doctor or you call your provider and something is going on, you need an acute visit and they can't fit you in, be willing to see some of the other doctors in the practice because we just want to make sure that you can get the care that you need when you need it because that's also something about primary care that is very important. You need to be able to access the care when you need it. So be willing to see other providers in the practice as well. But primary care is very, very important. I cannot overemphasize the importance of it. That's where you're going to get your screenings. A lot of work that has been done in cancer prevention, the survival rates of breast cancer, etc., and all of that is at the screening level. That's all done at the primary care level. When your doctor says, hey, you need to get your mammogram, it's important. There's a reason why they're saying it. And if your doctor is saying, hey, you need to get your colonoscopy, it's important. There's a reason why they're saying here because we have a lot of data that shows that these save lives. So listen to your PCP. Again, find somebody that you can trust, find somebody that you respect, somebody that listens to you. So
Very good advice. Thank you.
yeah.
So I understand you recently returned from a big trip. Do you want to talk about that?
Yes, yes. So I guess as part of self-care, if you will, I was recently in Egypt and Morocco, and I got to check two bucket list items off my list, so to speak. I saw the pyramids, which is just something that I've always, always, always wanted to do. And I was in the pyramid, and I still can't believe it. I'm still just basking in that euphoria from the trip. And I was in a hot air balloon. I always wanted to do that as well. It was a solo trip, and it was really good.
You organized the whole thing yourself?
Yeah, it was a birthday trip. I was like, I'm going to do this. Done. So I figured out what I wanted to do, found some tours, I booked them, and I just went. And obviously, because I was traveling alone and I'm female, so I didn't do anything stupid. Like, just be safe when you go traveling.
Sure, absolutely. So, is there anything else? This has been such a pleasure, and thank you for all the great insights and your great advice.
Oh, thank you. Thanks for having me. No, I think that's all I have for right now. It's been a pleasure just chatting with you, getting to know you better as well. So
Same here. Double, triple. Anyway, thank you so much for being on.
thank you. Thank you.
Until next time, thank you for listening to Everyday Creation. Please share this episode as you wish.